It's been estimated up to 1 in every 10 children in school acquires head lice at some time. We spoke with Dr. Michael Cater of Children's Hospital of Orange County to learn about the treatment for head lice.
The head lice, or the head louse, is a small animal that grows on the surface of a child's scalp. They feed off of small amounts of blood. They're intensely itchy, and it is a highly communicable condition, particularly in the ages of 3 to 12.
We asked Dr. Cater how head lice are spread.
And it's generally from direct contact with someone else's hair, usually another child's, or with combing equipment, brushes, combs, and so forth. Sometimes head lice are thought to be due to poor hygiene, but in fact, it's not. It's very present. It's present in virtually every school.
Dr. Cater tells us about the symptoms for head lice.
Usually the presenting symptom is intense itching. You've got these little beasties crawling around in your head, and they're moving around literally. It itches intensely, and they tend to predominate anywhere on the scalp, but particularly the nape and the back of the scalp area.
Dr. Cater explains what nits are.
Well, nits are the eggs that the louse lays, and they are very small. They're usually attached to the hair shaft. Most of them are within about a centimeter of the surface of the scalp, and they're attached with kind of a gluey substance, so they adhere. You don't want to confuse them with dandruff and things like that.
We asked Dr. Cater about the treatment for head lice.
The treatment is generally chemical in nature. The treatment of choice is a permethrin. It's an over-the-counter medication called Lice, and it's a cream rinse that you put on after you wash your hair. You leave it on for 10 or 15 minutes and then rinse it off. It kills the louse, and it also kills most of the nits. The ones that aren't killed are killed by the residue of the cream rinse on the hair shaft. It's not every medication is 100% effective, but it's quite effective, and generally we recommend that it be repeated in 7 to 10 days. Once a person that carries lice is identified in the family, you want to wash his bedclothes. You want to scrub the combing utensils well.
Dr. Cater discusses how to prevent reinfestation.
Preventing a reinfestation depends to a large degree on re-exposure, number one, or are you working with a louse that's resistant to the medication? I would say reinfestation most of the time is the issue that causes a recurrence of head lice because of another exposure to another child that has it.